I'm more familiar with the pain and challenge, but it doesn't get easier. The rate of failure is very high. As an entrepreneur, you're always paranoid. Nothing went according to plan. Who is driving this team, and specifically the team of founders?
Hello, we are in Malaysia and I'm really excited about our today's interview. We have an amazing guest. His name is Azran Osman-Rani. Hi, Azran.
Hi, Alex.
We are going to talk about lots of things.
Okay.
And of course, before we get to your current startup, we're going to talk more about some previous of your experience. Okay. So let's start with the question, and what would be a short answer to the question, who is Azran Osman-Rani?
Wow. Who am I? I'm a very curious soul. My whole life has been about wanting to do something different, wanting to learn a lot of new things. I get bored easily, and I love putting things together.
Interesting. Going through all your experience, all your positions and accomplishments, the first word that comes to my mind is success. Oh. Would you consider yourself a successful person?
No, not really. In fact, I don't think there's really an end line that says, okay, you're successful right now. I do think I would probably say, I'd rather be that person who's taken chances, jump into the deep end, gone into the unknown, and probably have come out of it with scars and wounds, and as you can see, all the hair pulled out of frustration, but I wouldn't have had it any other way.
Interesting. But what really amazing and fascinating about you, that you've accomplished really lots of great things in multiple industries. And it's pretty rare nowadays. People are taking years to get that expertise, build a network, learn the market, and many other things in one specific industry, and you did it in different industries. Why is that important for you to switch?
Sure. Well, again, industries is just one lens of looking at things. The way I look at it, I've been trying to solve the same problem, and I go deeper and deeper into understanding this problem. So whether it was a highly regulated, capital-intensive business like building an airline from scratch, to iFlix, internet video on demand, and now Naluri with healthcare, the common problem that I see across all of them is, how do we make services much more affordable and accessible and convenient to the mass market segment in emerging markets? Now, in each of these areas, what I've also learned is that deep industry experience is critical. But my co-founders, so my partners, have been the ones with that, right? So I worked with Moses. He had been in the airline industry for 36 years when he and I joined to build AirAsia X. My partner, Mark Britt, had built internet television in Australia and was coming to Southeast Asia to do it again. And now Dr. Jeremy Ting, my co-founder for Naluri, is a medical doctor and healthcare system specialist. So it's that combination of me bringing that curiosity, perspective, finding ways to make things affordable and accessible, and partnering people with that experience.
That's really cool. I wanted to talk a little bit more about AirAsia X.
Okay, sure.
And initially, it was like a startup. You found people who were willing to risk their money and invested it. And 6 or 7 years later, the company went public and basically became a corporation.
Yep.
And if I understand correctly, soon after the IPO, there was a crisis in the company related to some specific unpredictable events. And you came up with the anti-crisis plan. You came up with ideas how to solve this. But the board of directors, they were not really ready to take that risk anymore. And that's when you said, okay, I'm out, right?
Well, I think, number one, that's probably my biggest professional failure, right? So one thing, I think AirAsia X, building it from scratch to IPOing it 6 years later, 2,500 employees, $1 billion in revenue, nothing went according to plan, right? We started in November 2007. By 2008, there was the global financial crisis and oil prices spiking and crashing. 2010 was the Icelandic volcanic eruption that closed down the entire European airspace. 2011, we started flights to Japan, and the Tohoku earthquake, tsunami, and nuclear tragedy happened. 2012, we started flights to Christchurch, New Zealand, another series of earthquakes, right? 2013 was the one calm year, and we IPO'd that year. But nothing even prepared us for 2014, because there was not one, not two, but three black swan events. So March that year, MH370, the plane that went missing, still missing today. July, MH17, the plane that was shot down over Ukraine. And December, QZ8501, the fatal plane crash. And although none of the three were the ones directly under me, the impact on market was brutal, because travel demand from our core markets, especially Australia and China, which by then represented almost 60-70% of our business, plummeted because of the reputation from those airline incidents. So I came into that situation thinking, number one, as leaders, we're supposed to be decisive, right? Boom. And I came up with what I thought was a very logical plan, which was, okay, if travel demand from our core markets have plummeted, I want to take, 50% of our capacity and lease them out to other markets, right? So that it's not underutilized and bleeding cash, just lying idle, not enough passengers to fill it up. Because, you can lease them to European airlines who want to do summer charters to the Caribbean, or North African airlines who want to do flights for Umrah and Hajj pilgrim flights to Saudi Arabia, so that at least that capacity will be earning some money, right? At least a small amount. Plus, the other thing in 2014 was that our revenue currencies that we earn in, right? Malaysian ringgit, Australian dollars, Japanese yen, Taiwan dollars, Indonesian rupiah, all crashed against the US dollar. And 70% of the airline's cost is in US dollars. So at least if 50% of my capacity in my leasing contracts, I can denominate those contracts in US dollars, I reduce that currency mismatch, right? So a sound, logical plan. But what I failed to realize is that in times of crisis, people are less willing to be open to new things. And my biggest failure is that I didn't connect before I correct. I didn't spend time with individual board members to understand their issues, their concerns about the unknown, and help them see that what my proposal was could fit into their needs. Right? I didn't spend time building that connection. So it's not about always having the right answer, what the spreadsheet says, but whether you trust that person. And I think a lot of us probably can now relate to that, where we might have all had friends or family members who were hesitant to take vaccines during the COVID pandemic, right? So if you just went to them and said, here's all the WHO research, look at all the efficacy rates, are you going to convince them? No, because there isn't that connection in front. So that for me was probably my biggest failing and lesson in life, that it's not necessarily about just what's right on paper, logically, but building that trust and connection first and foremost as a foundation.
Does that mean that, for instance, Naluri is going public in several years, and you also have a board of directors to fix that issue? You're going to build the trust with this board of directors from the very beginning? Yeah,
in fact, I think one of the things that we did at Naluri, learning from that, number one, was to use boards effectively early on. I don't know of any other startup where even before Series A, Jeremy and I invested to hire a professional, independent, non-executive chairman, right? So someone who had been a CEO of 3 hospitals, who sits on the board of some of the largest insurance companies, who's got that stature and experience to sit and chair our board even early on. So that both we have someone who can guide sometimes differences of opinion between Jeremy and I, differences of opinion that we might have with some of our other investors who are on our board. But we take boards very seriously, right? Like proper board meetings, board papers, kind of updating and engaging board members, because you can't take it for granted. So it's not about waiting until we're listed, but even today, we run our board the way we would if we were a public listed company.
To kind of wrap up this conversation, still, would you rather be a part of a startup or the part of the corporation? Or it doesn't really matter?
Well, no, for sure, I get most of my energy in the creation process, right? So tackling a situation where things are super unknown, unclear. You don't know, where's head or tail, what's going to happen. Your product changes 10 times in a year. But I do also believe that speed and agility does need to have some sort of processes, right? So that you don't run in 10 different directions at the same time, right? So building that alignment, building that foundation is key. And one of the things I learned, especially the iFlix experience, where we went from, 5 guys sitting in a coffee shop in a mall to 700 employees in 30 countries, right? And if you just hire people in all these countries, they're just going to run their teams their own way because that's what they used to do before. Mm-hmm. But to get everybody to row in that same direction, you got to be very clear. This is how we make decisions. This is how we communicate. This is how, we resolve conflicts, right? Like, so that everyone's on the same page. And I think in writing that, so that it's kind of documented, it's what I call my Google Docs philosophy. Number one, write it down so that everybody sees it. But Google Docs means, well, if that no longer applies, let's edit it. So everybody can edit and comment on it. So it's a live document. It's not like it's a rigid process that cannot change. That's the inflexibility of big companies. But I think the Google Docs philosophy means you write it down so that everybody's clear. But as and when you go along and you think, that no longer works. This paradigm no longer applies. Those criteria need to be updated. We change it dynamically. And I think that's the beauty of startups that need to scale, because otherwise you'll just remain a small startup. But if you really want to scale fast, you got to have these foundational elements in place.
And what about taking that risk? Like, the decision is made in startups so much faster. Mm-hmm. And I have one of your quotes, which I really liked. It's that you said, pain of regret is much bigger than pain of risk. Mm-hmm. I understand, like, as a startup founder, you always have to take some risk. Yep. But do you have some boundaries? Like, this is way too risky. I'm not going to go there.
Sure. Short answer is yes. Clearly, I think first and foremost, definitely personal financial risk. Mm-hmm. I guess for me, because I went into these, so my career as a startup founder was followed by 15 years working professional. So I kind of built up a kind of like a reasonable financial foundation so that my kids' education, for example, are taken care of. Mm-hmm. So there's only I clearly define this is as much financial risk I'm willing to take personally. That doesn't affect my family's life, mm-hmm. right? So that's first and foremost. I think secondly, especially when it comes to healthcare, when you're dealing with very sensitive personal information, there are things that you don't risk. Just like, for example, in the airline industry, yes, we were the world's lowest unit cost airline. But where we achieved those, we were 1/3 the unit cost of Singapore Airlines. It came from how we schedule flights, how we kind of, change the capacity of, the seating arrangement of the plane and kind of how the pilots flew. But you don't sacrifice or cut corners with maintenance. You don't cut corners with the number of hours that your flight crew work, because that could be a safety risk. Same thing with healthcare, right? When you're dealing with people's data, those are risks that that would be a red line for us.
So since we started talking about healthcare, why did you decide to go in that industry specifically?
Interesting. So another coffee conversation, So I met a former Stanford classmate of mine. I went back to San Francisco. We had a bit of a reunion. I was then in iFlix, and he's a co-founder of a healthtech company, now one of the unicorns there. And I said, wow, so you're using digital to get people addicted to healthy habits. I'm using digital to get people addicted to mindless TV entertainment, right? I think you're trying to solve a really cool problem. But the other thing is I realized the problems that he was trying to tackle, especially with people with diabetes and how our behaviors and our mindsets affect that, is very relevant in this part of the world, especially because I had lost my own father to diabetes. And what I realized is that the whole healthcare system was just focused on his physical care. Take this medication, insulin, surgery, what have you, and no one provided any form of care to the inevitable depression and anxiety that someone who's going through these chronic conditions suffer. And when you don't provide that care, skip medication sessions, missed appointments, and things get worse. So the problem with healthcare is that it's too siloed. So I saw the need that, number one, mental health care, and particularly mental health care for these chronic conditions, is sorely lacking, and both the private and public hospital systems are way too siloed. Every doctor is only looking at you based on their specialty and not looking at you as a whole person. And also, when we first started iFlix, over 100 investors rejected us because they said, there's already this global giant called Netflix. But yet iFlix scaled to 20 million users in 20 countries in just 3 years, because it was much more locally relevant to that mass market segment in emerging markets. Because 80 to 90% of the populations in this part of the world don't speak English, don't watch anything from Hollywood, don't have credit cards for payment, right? And you really need boots on the ground to really engage and activate them. Same thing with healthcare. So the problem statement in healthcare is very relevant, just like it is that iFlix versus Netflix, and they were nowhere near as big in that space as Netflix is. So grab the opportunity and be the first to build that version here in Southeast Asia.
Interesting. Has Netflix ever approached you to buy iFlix?
So Netflix themselves, they're not really an acquirer. They tend to kind of grow more organically, but ultimately iFlix got acquired by a large Chinese company. So there were others who were in that video on demand space.
Tell us finally more about Naluri. What does the company do?
Well, if you think about Naluri as a preventive care solution, especially for mental health and chronic diseases, perhaps the best way to illustrate it is the problems that we're trying to tackle. I think as entrepreneurs, we really need to be fixated on the problem rather than the specific solution, because the solutions may change and evolve over time. But if you believe in these three fundamental problems, number one, problem with healthcare today, whether it's what we call healthcare 1.0, physical hospitals and clinics, or healthcare 2.0, telehealth, telemedicine platforms, both 1.0 and 2.0 are reactive and they're transactional, right? You wait until someone is sick and you expect that person to come to you. You're just waiting. What if we could change that model to a predictive model, finding people who may be sick down the line and helping them early on? And they're transactional, meaning it's one-off care, a single consultation, a single prescription. That may work if you've got a cold, a fever, kind of broken leg. But for chronic conditions, you need care on an ongoing basis. And if it requires ongoing conversations with your doctor, it can be very costly and inconvenient. So can we imagine a continuous care model that's much more cost efficient? The second challenge, as I alluded to earlier, is that it's very siloed by specialization. What if we could change the model instead of each doctor treating you individually, that you get your own multidisciplinary care team, your own psychologist, dietitian, doctor, fitness coach, pharmacist, all working as a team, guiding you based on your personalized care program. And the third challenge with the industry is that it's a fee-for-service model. Your doctor gets paid whether you get healthy or not, for the consultation, for the prescription, right? What if we could move the industry to an outcomes-based model, to a success-based model, or a guaranteed cost containment model? That would be a real game changer. So those are the three problems that we see with the current 1.0 and 2.0 models. And we're trying to imagine what would a 3.0 model looks like. That's predictive and preventive, that's multidisciplinary, and that's outcomes-based.
Interesting. Well, I've had so many conversations with multiple startup founders about preventive care and treatment care. And people always say all the money are in the treatment care because you can actually see the results.
Sure.
Somebody get healthy after he gets sick.
Yeah.
And preventive care, it's so hard to actually measure the results. Yep. So how are you going to solve this problem?
Great. Which is probably why we did not start as a B2C model, right? Because if you're trying to value preventive care for an individual, it's really hard. That is why Naluri is very much a B2B enterprise solution, specifically for payers in the industry, especially the big corporate employers and insurance companies. So these are organizations that, number one, realize they can understand on a population basis that, if today someone has early diabetes or early depression, if untreated, that's going to lead to them taking more days off from work and starting to need medication on an ongoing basis. So first is to work with the right constituents, the payers, to work on a population basis. Second, it's to measure things very clearly, right? Like say, measure depression, anxiety, and stress, measure blood sugar, blood pressure. And the third, it's what's the economic value of that? So we had the privilege of building probably the largest data set of 10 years of medical claims. When you have that data and you layer on top of that, we now have probably over 250,000 data points on mental health assessments and blood test assessments, you can start to kind of build these prediction models, which means we can now start to quantify. If I get you to lose 5 kilograms of weight, if I get you to drop your HbA1c blood sugar by 1 percentage point or your blood pressure by 10 millimeters of mercury, what's the value to you? Or what's the value specifically to your employer or your insurer? And again, it's not necessarily about you specifically, but if there are 1,000 of you with that kind of profile on a population basis, this is the kind of savings that we should see. So I think that's our take on preventive care, rather than that whole, I can somehow, convince you, the one person, that you're going to be healthy. That's tough. But statistically, if there's 1,000 of you with a similar profile, the employers and insurers, they have actual models, right, to quantify how costs will escalate over time.
That's really cool. My next question was about the monetization model, but I guess you've answered. Yeah. You work with the corporations, and there you have some specific fee for each employee, probably, right?
Yes, that's right.
And
that's the model today. Okay. We do want to change that model. Mm-hmm. So today, for example, we have probably more than half of our business comes from clients coming to us, right? Because number one, I'll give you an example of a mining company in Indonesia. They reached out to us because they had a mining engineer collapse with a heart attack, and they'd spend $50,000 for helicopter evacuation. That's a lot of money. Do you want to keep waiting for the next one? Or do you run preventive care programs, screen people, identify those with early risks? Because the cost of helping someone who's unhealthy in our way may be less than $100, right? So even if you spend 1,000 and you avoid one, it's still cheaper than waiting for that one person to have a heart attack, right? So one, it's actually, we've built that reputation, and those sorts of organizations, they understand the value because they have seen the effect of either someone having a heart attack, and in some cases, employers have had employees commit suicide or have had to be medically bought out because they can no longer function at work. They've resigned, right? Lost productivity from depression and anxiety. It's a real cost to them, right? So that you can quantify them and help them quantify that so that they understand, okay, I invest this much, I should expect to see a 4 to 5 times ROI. And if you can demonstrate a 4 to 5 times ROI, it's pretty convincing for most business leaders to make that decision.
For sure. Does that mean that, like you said, that businesses are approaching you? Does it mean that you don't invest in marketing or sales department at all?
No, we do. We have probably, I would say 80% of our business comes from our own business development or sales team, right? That goes out, reaches out to people. 20% comes from what we call distribution partners. So especially insurance brokers, third-party administrators, because they're the ones serving corporate clients. And their corporate clients are telling them, why are my costs going up 10, 15% every year? What do we do about it, right? And so they need to show that they can bring solutions to their clients, and they oftentimes introduce us to those clients. But even if we have what we call inbound leads, right? Someone reaching out to us, you do need to have a BD team that meets them, develops a tailored proposal, kind of gets them across the line. It takes, our sales cycle can be about 75, 80 days, right? So it's not like just log on to and subscribe to Slack, for example.
So I downloaded the app, of course.
Okay.
And well, first of all, amazing. So many features already implemented. But what surprised me a bit is that I found there like not just health coaches, diet coaches, fitness coaches, but also financial planners, career coaches.
Yes.
Is that something fairly new?
Well, it all happened during COVID because COVID was a time when we tripled our growth primarily on the back of employee mental health needs. And what we realized very quickly, right, when the psychologists are helping the employees, 50 to 60% of the reasons why employees today are burnt out and stressed and depressed is either workplace stress, my boss, performance targets, job uncertainty, and money. So as much as a psychologist can support you, I need actual tangible advice. So that's why we added those two types of coaches so that our employees of our clients can get real practical advice to solve their stressful workplace issues or terrifying personal and financial issues.
And is this feature popular? Are people actually using it a lot?
Yeah, so still I would say 97, 98% of our users engage with the psychologist, 80% engage with the dietitian, 60% engage with the fitness coaches and doctors. The financial planners and the career coaches would probably be about a 30 to 40%.
Still a lot.
Yeah.
Okay. How competitive is the market? Well, first of all, who would you consider your competitors, like direct competitors, and also probably indirect competitors? Like, for instance, we just recently published an interview with Dr. X, the co-founder of UCA. It's a Thai telehealth mental company. Would you consider them a competitor?
Yeah, so I would say that there are three types of competitors. Number one, the telehealth and telemedicine players, because they're probably the largest, right? And they kind of talk about, well, we have X thousands of doctors and they handle drug delivery and drug prescription. We don't do that, right? So while that may be convenient to me, it can also create a potential conflict of interest, because if you're making more of your money from drugs and less on the actual consultation, you may be incentivized to keep someone on that medication. As a preventive health company, we want people to get off medication. But they're the largest, most well-funded players. And we do have corporate clients saying, well, I have that for my employees. I don't need anything else. The second would be the digital mental health providers, right? You mentioned one in Thailand. There's probably another big one in Singapore and Indonesia. And so for clients who want to address employee mental health specifically, we would go head-to-head with them. And third, to a lesser extent, are digital chronic disease management providers. So similarly, right, there may be diabetes pure plays or cardiovascular heart disease pure plays, right? And in some cases, in Indonesia, there are also players who do something very similar to us. So these are all competitors, and sometimes it's also hospital chains, right? Because some people are like, no, more traditional, I want my employees to go to a doctor or clinic.
So going back to my initial question, would you consider it's like really competitive with the market? Or do you feel a threat that some competitor is going to take part of your shares?
Look, as an entrepreneur, you're always paranoid, right? You always have to be on your toes. Because what we've seen also is every year there are new entrants in the space, right? Because the more kind of, as you grow and you attract more funding, you attract more attention, it inevitably means you will attract new competition, or players from India, players from China and other parts of Asia, or even in the US who may come into this region, right? Just like how Netflix came into the iFlix market. So that's going to happen, right? So you just have to make sure we can out-execute everyone else.
Let's talk a bit about our expansion plans. I assume that you're already operating in the Southeast area, and are you planning to go somewhere else? Well,
at the moment, we're very focused on Southeast Asia. So we're headquartered in Malaysia. We have operations in Singapore, Indonesia, Thailand. We have early kind of presence in the Philippines. But If we were to expand beyond, it would be markets like Philippines, Vietnam, the other Indo-Chinese markets like Cambodia, Myanmar. That's our core. That's the kind of geography that we understand the best, rather than trying to put ourselves in faraway markets where we don't have the local knowledge and relevance to really be outstanding.
But going, 5-10 years, would you imagine yourself, try to enter American market?
Well, I don't think we would organically.
Okay.
Having said that, right, we are starting to work with some of the largest insurance partners, for example, right, or managed care organizations, because number one, they have regional clients and they have even global clients, right? And so if it works here, and if they are going to take us to these markets, yeah, we would take up that opportunity, rather than us going into a new market like Europe, greenfield, trying to meet people by ourselves. We wouldn't do that. But if we've had powerful partners who say, look, what you've built in Southeast Asia makes a lot of sense in Europe, because Europe's a multi-country, multi-language, multi-geography, kind of the same challenges we have in Southeast Asia also apply to Europe. And they have their existing customer base that they just want to apply our solution, then that's something we would look at.
Okay. What's on the roadmap and the short-term plans?
Well, I think in a short term, I think this year it's definitely going deeper into our current markets. I'm particularly bullish about Indonesia, specifically because there's just so much opportunity and so much demand. Again, these are markets where people are coming to us. I think Philippines, Vietnam, probably the kind of next set of expansion. But I also want to make sure that we deepen our investment in product development, both in terms of various kind of features, but also I think deepen our capability in healthcare economics, right? Like the kind of actuarial models to quantify further and deepen our healthcare costs models. Okay.
Of course, regular questions when you talk to startup founders about the money. You've raised more than $8 million already, right?
15.
15? Yes. Oh, I have all statistics, I guess. Right. My first question, how hard was it to raise money? Like, has your previous experience working in different other industries, did it help you to raise money?
So if you combine the AirAsia X rounds of funding, iFlix round of funding, and Naluri, I've probably done over 12. Each one of them, really hard. Each one of them, it's really almost like a 1 in 10 ratio. So for every one investor that ultimately comes on board, you got to talk to 10.
That's so it's not a numbers too bad, though.
And so I'm more familiar with the pain and challenge, but it doesn't get easier because it's still about, till today, right, numbers. And I think 2023 may yet be the toughest year.
But still, when you come to an investor or a VC fund, do you say like, oh, I created an airline from scratch, which became super successful, and does that help to convince investor to give
Well,
money?
I don't start with that pitch, right? I'll say, look, this is my third venture. I've been working across a number of industries, and my problem and what I'm really passionate about is tackling that affordability and accessibility point. I also work with Jeremy, who has that deep industry experience. I think that does count, especially here, where what that means is, as a founder, you not only know, okay, the hard parts of taking an idea and building your first MVP and getting your first clients, but you also know, okay, well, what does it take to run 1,000 people organization, right? To manage $1 billion in revenue and all of the challenges and complexity there. So I think that does help being an experienced founder.
Cool. How big is the team right now?
We have about 200 full-time employees.
What's the percentage of the software developers?
So roughly we are 1/3 healthcare providers, 1/3 product. So software engineers, data scientists, product designers, about 25% sales, marketing, client service, and the balance 8%, 9%, kind of management, admin, legal, finance, HR.
All right. AI chat is already part of the app. How does it help your users?
Number one, we're deep believers in human healthcare professionals.
Okay.
Where we use kind of AI or machine learning analytics is behind the scenes. So whatever you type, a machine is analyzing that to detect what we call a distress score, right? So if you're saying, look, I'm thinking of ending my life, right? That's going to suddenly ring alarm bells, and a human professional is reaching out to you. What we've tried to experiment on the side, and we know it doesn't work, is trying to use a chatbot, because all it takes is just one message, right? And literally, like in a test, one of our employees had written like, "Oh, I think this year is a really good year to end my life," and the chatbot responded, "I agree." Right? So you never ever we are dead against putting that chatbot on the front line.
I wanted to ask. In multiple interviews, you say that you're trying to be a role model for your employees. Who is a role model for yourself?
Wow, that's a really good question. It's interesting because I think sometimes when we think about role models, we think about people who are older than me. And I definitely have had, quite a lot of people I've learned from, right? For example, Mayak, he was the partner I worked for in McKinsey, and he's now actually running his own venture capital fund, and they're one of the investors in Naluri, right? Or the former executive chairman of the stock exchange that I worked at, because I really look up to him because of his work ethic, his persistence, his ability to bring different stakeholders together. But I also look at other entrepreneurs as role models, and sometimes people much younger than me. And then one person, for example, Mandy Leung. So she's really young, still in her 20s. She built her own cosmetics brand, right? And I met her at one of these business plan startup competitions, and she was telling how, she just bet everything on getting a spot on one of the TV stations, TV infomercials, and that kind of created that big break for her, right? But just her undying belief in building her own brand, and rather than just being a distributor of other people's products, that kind of gumption, even though she's in her 20s, I'd say, yeah, she's a role model for me.
Cool. Well, when I was listening lots of to your interviews, my personal opinion, you have a lot of similar things with Steve Jobs.
Oh, good Lord.
In terms of your inspirational speeches and stuff, I think there are lots of common things with you. On the other hand, I think there's also... that what came to my mind as some similarities with Richard Branson. He also has multiple successful businesses in different industries, which is also very common for you. And of course, he has an airline as well. He was started an airline as well. So I think there's definitely lots of role models out there in the world. Yeah. And this is really important for employees to see that role model as a CEO of the company.
Yeah, I agree. Look, if there's one global leader I would definitely look up to, Satya Nadella, right, who runs Microsoft, who just, the most important thing is saying from, we've got to change ourselves from being knowers, that we know all the answers, to learners, right? And when you have to move 200,000 global organization, that is really hard, right? And he does it with such humility.
You're also an angel investor, right?
Yes, I am.
How do you choose and select the startups you want to invest in?
100% based on founders. So I only invest in people that I know, that I know personally, because to me, I've seen every possible business plan, and even my own, I know it doesn't materialize. But what counts is who is driving this team, and specifically the team of founders. Are they the right people to tackle this problem? Everybody can bring to you an exciting problem, but why is it this team the right team to tackle the problem? So the companies that I've invested in are people either who used to work for me, or maybe I've mentored them as part of some accelerated programs. So I kind of know them. And so those are the people I back. In fact, for me, even at Naluri, right? 5 rounds of funding, virtually every investor that's come on board were people who we had known for at least 12 months, right? And sometimes, very likely, they'll have said no the first time we talked to them. But we kept them updated, right? And built that relationship. And the next time around, they'll come on board. So same thing, I think, with angel investments. If you approach each investor saying, please invest in me, and I don't know you, you don't know me, the rate of failure is very high.
Of the book 30 Days in 30 Years, why do you think entrepreneurs should read this book? How can it help?
Well, this book, the genesis of this book came from that whole iFlix experience where in order to convince, let's say, 30 different country heads, you need to have everyone on the same page, right? So we wrote, this is how we're going to hire people. And that turned out to be a chapter in the book. We wrote, this is how we're going to communicate. That became a chapter in the book. This is how we're going to do performance appraisals. This is how we're going to run board meetings, right? And I then added to the book all the stories, the issues, the frustrations that I have to illustrate these points. So in a way, it is kind of a manual of scaling a business and trying to move faster. But hopefully, I've had to share the many mistakes that I've made, and maybe it can help someone avoid some of those mistakes.
Perfect. We'll definitely gonna leave the link to the book. You can either download it or find the offline version. Actually, since we started talking about the mistakes, my final question, it's not really a question, can you give some kind of recommendations of pieces of advice to other startup founders, ideally in digital health, but not necessarily, or maybe some mistakes that you did that you don't want other startup founders to do?
Well, again, as I said, number one, law of numbers. So whether you are raising capital from investors or trying to pitch to clients, prospective clients, especially for kind of B2B models, that law of number of 1 in 10 kind of holds, right? So whether it's, I've talked about investors, but even let's say in our sales cycle, for every 100 clients that we meet, we're able to have full proposals sent to 50. And then finally only 10 will sign on the dotted line, right? So if you're not addressing the top end of your funnel enough, your growth is going to be very limited. And I think related to that, of course, is leveraging networks. Because a lot of times you think, okay, I know these clients, I know these investors, and they're just within your circles, right? But very quickly, you're going to run out of it. So how do you either get into other networks so you can get introductions, or hire people who've got new networks? So I'm a big believer in warm introductions rather than cold calls. Right, so if I get into a network where someone can give me a personal introduction, that's going to have a much higher kind of success rate, right, than simply writing a LinkedIn message to someone who doesn't know me.
This is great. I want to say that I have a dream. I haven't really told anyone about it yet. After Ukraine wins the war, I'm really dreaming about making and organizing a conference in digital health, since there's lots of things that we need to rebuild after the war ends, and digital health and health specifically is one of them. And you're going to be one of the first people I'd love to invite, because with all your inspirational speech and all your experience, I think this might help lots of startup founders in Ukraine to build successful companies. So hopefully that's going to come soon. So wait for the invitation.
Oh, thank you. Look forward to it.
Thank you, Azran, for this interview. It was really a pleasure talking to you.
Thanks, Alex.
Thank you.
Take care.
Bye-bye.